Okay, so this is a trauma patient assessment on a school-age patient. This recording is for clinicals. The first step is putting on proper PPE, which is gloves. And we have been called to a scene in a playground where a patient cut their left arm by sticking out a piece of plastic. The cut is pretty deep, but that's all the information we have been told. So as I am arriving on scene, I'll make sure my scene is safe. I will determine the mechanism of injury, which is a deep cut on the left arm with a considerable amount of bleeding. And that's our mechanism of injury. I'll determine the number of patients. I only have one patient. I do not need any additional EMS. And I will not consider C-spine because of the way the patient is sitting and the mechanism of injury. I wouldn't consider C-spine. I'll move on to my primary assessment. So the first step is stating the general impression of the patient. So we have an 8-year-old female weighing about 60 pounds that's sitting on the playground with her parents, of course, that's clearly in pain with a bleeding left arm. So I will really quickly check the pulse, motor, and sensation. So there is a weak pulse on this arm. Can you wiggle your fingers? Okay, and which finger am I touching?
The pointer.
Okay, I will now, of course, control any life threats, which is the bleeding. Because this is a considerable amount of bleeding, I will apply a tourniquet. But of course, in a real scenario, I would first apply direct pressure. If that doesn't work, I'll apply a tourniquet. So I will apply the tourniquet 2 to 3 inches above the injury, and I'll make sure that it is tight enough that it cuts off circulation to the extremity. Okay, so there is no pulse. I will now check. Okay, can you wiggle your fingers? And which finger am I touching?
The pointer.
Okay. So I will now move on to checking the patient's responsiveness. The patient's obviously responsive or alert, and I will determine the chief complaint, which is a cut on the arm. I'll move on to my ABCs. The airway is open because the patient was talking. And now I will check the breathing and the pulse on the same time. So I will check the pulse on the radial artery by the non-injured arm, and I will assess the respirations by chest rise and fall. So we have a strong, regular pulse and adequate respirations. And so I will initiate oxygen because the patient's skin color is pale and they have been bleeding, so there is a chance they might be going through a shock. I will do that through a non-rebreather mask attached to oxygen at 12 liters per minute. I will assess the skin color, which, like I said, is pale. The skin is warm and dry. And then I will now make a decision about the priority. So this is a high priority patient, which means I will initiate transport. I will transport in a supine position. I'll make sure the patient's warm and continues receiving oxygen because there's a chance they might be going through shock, but I'll take the precautions. While en route, I will take history and obtain vital signs. So I will obtain the sample history. So I will of course talk to the parents at this point. So I will determine if the patient's allergic to anything. So the patient is allergic to peanuts. The patient's not taking any medication. Their past medical history was a growth hormone deficiency, and their last meal was a sandwich. And what happened, the events that led to this is a cut. I will now talk to the patient about the present illness. So does anything make the pain feel better?
No.
Okay, and can you describe the pain for me?
It hurts.
It hurts? Okay. And does it spread anywhere?
No.
No? Okay, on a scale of 1 to 10, 1 being no pain at all, and 10 being the most pain you've ever felt, where would you rate this?
An 8.
Okay, and this started 10 minutes ago, as we have been told. And now that I've obtained my SAP1 OPQRST, I will take patient's vital signs. So we have a pulse of 91, respirations of 22, a blood pressure of 104/76, and an SpO2 of 99%. And I will now initiate my secondary assessment. Because the only injury is the bleeding arm, I will only check arm for any additional deformities, making sure that the pulse is still gone because of course I applied a tourniquet. And that's all for my patient. I will make sure that the patient is transported supine, is warm, continues receiving oxygen. I will reassess every 5 minutes by taking vital signs and reassessing and doing the primary assessment, and I would provide an accurate verbal report to the receiving hospital.